introduce Dr. Amy Dickey. Dr. Amy Dickey is the co-founder and co-director of the Porphyria Center at Massachusetts General Hospital in Boston. She initially studied immunology related to HIV/TB co-infection. Concurrently, however, her personal history with EPP and her increasing involvement with the Porphyrias Consortium convinced her of the great need for researchers to study porphyria. Her primary research interests include measuring light sensitivity in EPP, understanding the reasons for differences in light sensitivity between patients, and testing new therapies for EPP. In addition to research, she has also served as spokeswoman for our porphyria community, speaking to the Food and Drug Administration about porphyria, writing an opinion piece on Stat News, giving lectures to physicians about porphyria, and presenting at porphyria patient support groups. We are so lucky to have Dr. Amy as a porphyria expert and a member of our community. I am very lucky because she's also my doctor, and I am completely grateful for her. Amy, thank you so much for joining us today. I'm going to turn the mic right over to you.
Great. It's so wonderful to be here and see some familiar faces today. And thanks for that introduction, Ginger. I will share my slides. Light protection and porphyria. And as Ginger mentioned, I have a personal connection to this topic. I have EPP with erythropoietic protoporphyria myself, so had a lot of issues with light sensitivity my whole life, as a lot of you on the call have as well. And I also am a doctor and researcher on the topic of porphyria, so I have that perspective as well. So I'll be sharing just a few slides today, but every EPP patient, most porphyria patients are experts, themselves on, what works for them or not in terms of light protection. So it'd be great to hear from a lot of tips from different people about what works for you. Okay, here's my disclosures. And so as an outline, my goal is to just give a brief overview of light protection and porphyria. First, start with an overview of porphyria. Need to talk about some wavelengths of light as background to help understand the different types of protection and why certain things work or not. Want to talk about sunscreens and different types of light protection. And also want to share some unpublished data I have about what some EPP patients do in terms of sunscreens, light protective clothing, what brands of light protective clothing people use and think are helpful, and then some conclusions, and then questions. So first of all, as you all likely know, porphyrias are defects of heme synthesis. Heme is what carries oxygen on red blood cells, and there's many different steps in the making of heme that lead to the different types of porphyria. So the body takes glycine, succinyl-CoA, two different substances, through a series of 8 different steps to end up with heme at the end. And with porphyria, you start with 2 products and go to heme at the end, and then there's some obstruction at different places. Each type of porphyria is obstruction in a different place. But then because of that obstruction, there's an overflow of these intermediate products that are causing problems. And in porphyrias, a lot of the different products in the middle that overflow are light sensitive. And so here's actually a picture of the different intermediates to get a sense of, this is kind of how chemists draw it. So don't need you to understand a lot of this picture, but I just want you to see that over here is chlorophyll, which is what absorbs energy from plants for photosynthesis. And then here is all the different, protoporphyrin is what builds up in EPP. And then the other types of porphyria, there's also other pretty similar looking molecules. And so all of these, oh, actually, I labeled this wrong. So protoporphyrin is the one down. The top one is heme. The one down is protoporphyrin. And then there's uroporphyrin, coproporphyrin, and the different ones that build up in other types of porphyria. So in EPP, the protoporphyrin, this one here is the main one. And then PCT, variegate porphyria, other types of porphyria, it's generally this like coproporphyrin, uroporphyrin, and some other porphyrins in between these that build up. But they all have this structure that can absorb light, and then it spits out like fluorescence and also what's called free radicals, so basically damaging substances into the skin and other places. And just as a background, this presentation, I have EPP, but it's a presentation for, not just about EPP, light sensitivity, and porphyria. So I just want to give some background of the different types of porphyria. So the three main types are acute intermittent porphyria that causes abdominal pain, nausea, seizures induced by different medications, stress, hormones. Porphyria cutanea tarda causes that patients have the slow onset of blisters and scarring on sun-exposed skin, generally starts in adulthood. And then EPP, there's very painful cutaneous light sensitivity with sometimes with redness and swelling that starts in infancy. And it's because these different products are all light sensitive, but because some of them dissolve in lipids, some of them dissolve in water. So depending on that, they go to different places and have somewhat different effects, even though the light sensitivity mechanism is pretty similar between the two. And then in EPP, so these are the other types of porphyria. So, the EPP and XLP, they cause a painful light sensitivity. CEP, PCT, VP, HCP, multiple of the other types. So HEP causes the blistering, scarring, light sensitivity. And that's basically the main reason is due to where the porphyrins dissolve, whether they dissolve in water or dissolve in lipids, and so they go to different places. But in terms of light sensitivity in the porphyria, have to start with some background about light and wavelengths and what is causing the issue in the porphyria. So here is basically a graph of different wavelengths of light and what type of light it is. So you've all heard, light itself, it's basically a wave. So you can have really tight waves here in the UV, and then they get broader, broader, broader. And then in the infrared, it's these big wavelengths of light. So the wavelengths of light is measured in nanometers. So UV is essentially 100 to 400. So these like tight waves. You can think of people with curly hair. Some of them are really tight waves. Some of them have really big waves. But the tight waves, the UV, they're the ones that can do damage to DNA and that can cause skin cancer. And those are the ones that cause sunburns here in the UV radiation. And then the visible light, that's what you see. There's blue light, green light, yellow light, red light, those different colors of light. So UV light, you actually can't see the UV per se, even though usually with the UV, if there is UV light, there's also visible light there most of the time too, but it's the visible light you can see. And then there's infrared radiation, kind of like microwaves, you like microwave stuff in and then sometimes this infrared is used for different types of like phototherapy and things. But when it comes to different wavelengths of light, for sunburns, the main wavelengths that actually cause sunburns are UVB over 290, 320, so over in this range here. And then sunscreens, like regular sunscreens that you buy off the shelf, most of them cover exactly that range because that's what people in general are trying to block, this 290 to 320 wavelength here. And then broad spectrum wavelengths are 280 to 370. So kind of almost getting to 400, almost getting to the visible light, but not quite. And then there's also, zinc oxide and titanium dioxide. They're called like mineral sunscreens. They have a little bit broader wavelength, so they go almost to the visible, like kind of zinc oxide goes essentially right to the visible spectrum. Titanium dioxide might go slightly over. But they're, generally the UV range still, the broad spectrum, don't really go much, if anything, into the visible range. And then here is the protoporphyrin molecule. All the other porphyrins for the other types of porphyria have a very similar spectrum. So I'm just going to give the protoporphyrin spectrum, and the other types of porphyrins are basically the same or similar. So here is basically if you have like the protoporphyrin that builds up in the blood in EPP, if you dissolve it in water and shine different wavelengths of light at it, what wavelengths does it like absorbs a specific wavelength here, in the black, and then it also spits out a specific wavelength. Because so if you take the plasma from an EPP patient, so take out the blood, take the plasma. I remember when I was in middle school, Dr. Bottomley in Oklahoma, she took my plasma and shined it under a light and you could see it fluorescing. So it essentially, it absorbs light. It also spits out light of a different wavelength. And then it also can spit out something like called free radicals, like different damaging substances. But the wavelength, the peak wavelength that it absorbs is 405 nanometers. So here in the visible range. So kind of outside of what sunscreens are blocking. And EPP, there's actually, or the porphyrins, the main peak is at 405, but there's also other smaller peaks here. 625 is another main peak. And so this spectrum is if you like dissolve protoporphyrin in fluid, but also in people, the protoporphyrin isn't primarily at the surface or in a solution. It has to go through skin. And so this 625 also goes deeper into the skin than the 425. So even though it looks like a pretty small peak here, it probably is actually a bigger peak in terms of where it's actually doing its work. And then some of these wavelengths at in the 500s is blocked by like skin and blood and other things. So these probably don't have much of an effect. So 405 and 625. So 405 is pretty close to where zinc oxide and titanium dioxide are blocking, but like 625 is way far away. It's not doing, even those aren't doing anything at the 625 range. And so, I know a lot of EPP patients have tried different sunscreens. There's not actually great data about whether any of them really work in EPP that much, but I'll share a little bit more information about that. But for EPP, likely the best sunscreens to try if you're going to try something for EPP are the zinc oxide, titanium dioxide sunscreens, which in those cases, it's basically blocking this part of the spectrum here. It doesn't actually block the peak, but it blocks some of this over here. So, if you're looking for sunscreens to try things that say zinc oxide, titanium dioxide in it. And here are some examples of some common sunscreens that have zinc oxide and titanium dioxide. Of the ones that, this blue lizard sensitive mineral, it has the highest amount of titanium dioxide that I was able to find. And so that might be a good one to try. A lot of the mineral sunscreens, it does end up looking white on your skin because that's kind of the purpose, it has to be kind of thick and gooky to like be blocking the light because you're blocking visible light. So you can't really have it 100% invisible, but these do have very, very tiny particles. So you shouldn't be able to see it too much on your skin. It should rub in, but the UV protection can be 100% invisible because the wavelengths are so small, but you're blocking a bigger wavelength in UV light. So it's harder to do that. And then, so a while ago, I did a survey of patients. I did a study of light dosimetry, basically measuring light dose over time in patients. And in the enrollment survey, I asked people some of their practices in terms of light protective clothing and sunscreens and what they did. In the survey of 35 EPP patients, 31% of them wore normal non-mineral sunscreens typically, but only 18% thought that it was helpful for EPP symptoms. And also 14%, so actually only about 5 people wore zinc oxide sunscreens, but 80% found that it had some help to the EPP symptoms, and that's like 4 out of 5 people. But sunscreen itself, even if it doesn't help with EPP symptoms, it helps prevent sunburns. I mean, you don't really get that many sunburns in EPP unless you're on, if you're on Scenesse or Bitter, now you might be able to go out in the sun more. And so it's definitely good to prevent sunburns in that case. Sometimes you can get in really big trouble if you're not used to being able to go into the sun. Now you can. But still, sunscreens help like slow aging, prevent skin cancer. So there's a lot of, wise reasons to use sunscreens that are separate from, EPP itself. But in general, I think zinc oxide, some of those titanium dioxide might have a small effect, but probably not a super big effect in terms of preventing symptoms in EPP because it doesn't really cover the main peak that causes symptoms. But also light protective clothing, though, is really helpful in EPP because, the light protective clothing is essentially blocking the visible light. So, the main thing to look at is trying to find, if you basically shine a flashlight through your clothes, can you see light come out the other side? The more opaque the clothes, the better it is in EPP. It's visible light, so you can actually see it, the light that you're trying to block in EPP. And so in this survey, I asked patients what types of light protected clothing they wore on a typical day. And about 50 to 60, 50% of patients did wear some light protective clothing on a typical day, like hats and long sleeves and sunglasses. And then the types of protective clothing that people wore sometimes to protect from EPP, like almost 90% wore hats sometimes, long pants, gloves. So, I think in this graph, only not too many people wore sunscreen that much, but certainly light protective clothing was a lot more common because I think a lot of EPP patients have tried a lot of different sunscreens, didn't help that much, but certainly light protective clothing does. And here's what people said in terms of preferred brands for light protective clothing. A lot of people said Coolabar and Solumbra. A lot of those have some like UV protectant clothing. But yeah, one thing to check for any of the clothing is just to make sure it blocks light. You don't want like really thinly woven clothing where the light's passing through really easily, and like thicker clothing is going to block the light a bit more. UV rating for the clothing itself may not translate that well to EPP. It's hard to say, but just, it's measuring a different wavelength than the wavelengths that's important for EPP. But some of the UV protective clothing is helpful because they are pretty, tightly woven clothing that's probably blocking light for that purpose too. The UV sun like umbrellas, they have thicker layer and it's blocking more. So, I think probably UV protective clothing is probably better in some, like if you're going to get gloves that are, UV protectant, you might have a little bit more light blocking capacity, but the UV rating itself, it's probably not a one-to-one translation to how well it protects with EPP. So that's just a brief overview. I think a lot of people with EPP have tried different things. The main conclusion is that light protective clothing that is opaque, tightly knit is helpful to basically block that visible light. Sunscreens, if you're going to try it for EPP, try something with titanium dioxide or zinc oxide. Other types of regular sunscreens probably don't really work for EPP, but there's other reasons to use it. So I'm not saying don't use them, but just for EPP, it's probably not going to work that much. And then, for every patient, there's probably a bit of trial and error to find what sunscreens and light protective clothing work for them. And just want to say with EPP and other types of porphyria, I think EPP is so painful. So there's a pretty, immediate feedback of like what's working or what's not in terms of their light protective clothing. And the trial and error is more like on a day-to-day basis, like, oh, this didn't work. I can find out immediately. That does work. I find out immediately. Some of the other types of porphyria, the blisters and such, come slowly over time. It's not quite as quick feedback about what's helping or what's not. And so probably with other types of porphyria, you might have to be a bit more vigilant of like, oh yes, I need to put on a hat. I need to put on gloves. With EPP, it's so painful that it's, pretty strong motivator to protect from light. But, for some of the other types, it may be more important to, set reminders and have people remind you and to be more vigilant about that to prevent the long-term injury over time. But yeah, I'd love to hear what works for you. I have my experiences and, this is some of the, science about, wavelengths of light, but I think every porphyria patient is an expert about light protective clothing too. So I think a lot of people probably have a lot of good tricks as well. So here's some thanks to people who helped with the presentation. So thanks, everyone.
Thank you, Amy. Anna, do you have those questions?
We did get a few questions submitted by email, and then if you have questions, please just put them in the chat. So the first question we had was, I was recently diagnosed with secondary porphyria, and they said their doctor doesn't think it's a genetic porphyria, but they experience extreme sun sensitivity and react to the tiniest amount of light, even indoors, while wearing sunscreen and multiple layers of sun protective clothing. So they were just wondering if there's any recommendations for sun protective clothing, window tinting, and sunscreen for someone whose reaction is pretty extreme.
For that question, I think secondary porphyria is probably Porphyria cutanea tarda. That's the only one that can develop without a genetic mutation. And for that, that sounds very, very hard. I've known of other people in that situation too that react a lot to indoor lights. I think the sunscreen would be the Blue Lizard one that I posted about that has zinc oxide, titanium dioxide. Also, just opaque light protective clothing inside. In terms of light, sometimes people can pick indoor lights that have more red in them versus blue, because the blue likely affects EPP more. So if you go to the store and find ones that have more of the red spectrum, so blue is like 400 to 500, and then red is more like 500, 600, or more than 600. And so trying to, in terms of nanometers, so I think that might help. And then also kind of the, like you said, the covering for the windows, and it's blue light probably affects EPP most. So there's certain like blue light filters and things you might be able to find that block less overall light, but maybe more of the light that is important for porphyria.
Thank you, that's great. So another question we had was, what does it mean if my skin symptoms are worse on cloudy days?
Well, a lot of times for EPP, at least, if you're in the sun a lot one day, your light sensitivity increases the next day. So it's sometimes not the day that you get the most sun that you have the most symptoms sometimes, especially if it was after a day with lots of light. So I wonder if that could be the reason. And then cloudy days, sometimes cloudy days, there can be pretty the clouds don't always block that much, and the sun still can be pretty bright through the clouds. Like I remember living in Seattle and people were like, oh, it's going to be cloudy, your EPP will be great. And, it still had, very, very intense sunlight despite there being clouds. So it's, sometimes, yeah, I wonder if that's part of it, but hard to say.
Can I give my answer to that?
Sure.
Being a fisherman. So when it's sunny out, you know where the sun is coming from, and we turn to it, we keep our back to it. When it's cloudy, you don't always know where the sun's coming from. Don't turn from it and protect yourself and hide in the shadows as much. That's my experience, and I go by that 100%.
Yeah, that totally makes sense.
I agree with him 100%.
Thank you for chiming in, Victor and Ginger.
I did find the thing if you want me to start reading the question.
Sure, go for it. I'll
Okay.
disappear again.
Questions for relieving burning pain following sun exposure.
That's so hard because
So hard.
EPP, there's really no therapy that we know of that relieves burning pain after it starts. There's treatments that prevent it. I think most patients, like cold and ice helps relieve the symptoms some. I've heard of actually someone recommended, it suggested, maybe trying things like EMLA cream. I know we've used EMLA cream sometimes for like procedures in dermatology. I wonder if that might help with some of the EPP symptoms. I don't know if anyone here has tried that, but you know, I unfortunately there's nothing that we know of that really treats the burning pain except for just waiting in a dark room with cold and ice. I of all people wish there was, you know, I think that's a really big unmet need in EPP is some therapy to treat the pain in a reaction. I don't know if, yeah.
I find the fan, wet rags, the typical.
Hmm. Yeah. I think everyone
Okay.
his
Hmm.
patient has tried those things. And so like is, you know, a lot of these questions, there's not data on it. I'm just like, you know, sharing my experience. So if anyone else has other experiences, that'd be, you know, good
How
to
about
share.
options for treating insomnia following sun exposure, which I know is a real problem?
Yeah. Yeah, sometimes with reactions it's so painful. So you have to like, you know, like it's hard to sleep for days on end as you're in pain and can't sleep. I mean, there's different like Benadryl can help with sleep, and you know, sometimes people have thought there's maybe a histamine aspect of it, so maybe there's some effect, hard to say. Like that might help. You know, I have there's certain prescription medications for sleep, like Ambien and such, that I think can be helpful for sleep in situations like that. But yeah, and then like for me, like, you know, taping ice around my hands and face. It's yeah. I think Ginger, you had some ice.
Ice dependent issues. Yes, I am ice dependent.
Yeah.
I hate to say it, but when you
Um,
when you use water, you use ice, then you can't go back. There's like no go, you can't turn back. And
mhm,
if I'm burning and I feel that pain, I do turn to ice in cold water, and
mhm.
um
You said
it's
you
a
had
struggle.
someone strap the ice on you, or wasn't that anyway? Like it was.
I have, yes, I have taken scarves and tied ice packs to myself. Um, you got to do what you got to do.
Yeah.
Okay, the next question. Do you have feedback on the results of clinical trials for future drugs for EPP?
Um, yeah, so it's a really exciting time for EPP. A lot of, you know, the bitopertin trial just finished the phase 2, and there's one that's starting it decreases the level of protoporphyrin, and it seems to be really effective for symptoms and preventing symptoms in EPP. So I'm really excited about that one. So I think if anyone is considering being in a clinical trial, I highly encourage you to do that one. There's dersimelagon. It's a trial for basically an oral version of Scenesse. It increases skin pigmentation to block the light. So sunscreen blocks just the UV range, but melanin or natural skin protection blocks a broader range of light. And so it like including the lights that are important for porphyria, and it also has a strong antioxidant effect. So it works in that way. So that also is likely effective as well. So yeah, it's an exciting time. So hopefully soon there'll be more and more options for EPP patients and other patients with porphyria. I think bitopertin would also help other types of porphyria too, the other cutaneous types of porphyria. So yeah, really interested to see what's going to happen in the next few years.
Very exciting. Okay, the next question. Is there any cumulative effect of sun exposure, even if you don't feel immediate, like EPP, you feel pain? Is it causing harm? Sometimes at home, we don't protect that much. My HEP child, but I'm curious to know how this might affect long-term cumulative problem.
That's a really good question. I don't
Very
think we
good.
have a lot of good information about it. Certainly in EPP, there's a cumulative effect in that if you're in the sun one day, don't have any symptoms, but in the sun a lot for you one day, then the next day your light sensitivity worsens. So I think there's some effect of like protoporphyrin just moving to the subcutaneous tissue and having more of it there ready to react to light. And in terms of with the blistering cutaneous porphyrias, it's more of like long-term light fragility that or skin fragility that develops, and there's not as much immediate feedback as there is with EPP, and there could be, deep things, there could be damage that you don't notice until like a week later. So hard to say how much cumulative effect. The indoor lights itself is not super bright in terms of like compared to outdoor light. So whether or not that's having an effect, I would assume that if there's not like visible skin changes that you're seeing after a week or two, that it's probably not having long-term damage. If but hard to say for sure, but I think for other types of blistering porphyria, probably, in EPP, you can get feedback on the level of like an hour or 2 hours, the next day, whereas in the blistered cutaneous porphyria, it's more like a week, 2 weeks, but probably not like years, and then you get an effect. So yeah, so I think it's a little bit harder to monitor as compared to EPP, where you get more immediate pain feedback. So yeah.
Okay. The next question. I was wondering if anyone had any advice about protection against intense indoor lights, like the ones found in a gymnasium. I play volleyball and need protection that could be worn while playing. I usually deal with pain on my hands and lips when playing volleyball. Thanks.
Yeah, for that, it's hard because a lot of the indoor gymnasium lights have a lot of blue light and rather intense blue light. And so a lot of the sun protective tips I mentioned in the presentation for outdoor could be translated to indoor too. So like maybe trying titanium dioxide and zinc oxide sunscreens, and then also just light protective clothing. And if in the gymnasium, there's sometimes some places they're able to like turn off half the lights or dim the lights some, not every place they can do that, but could request things like that. But that's indoor lights is hard when there's a lot of sensitivity to that.
Has anyone tried HelioCare capsules, oral sunblock?
Yeah, so I believe HelioCare is basically a really strong antioxidant that basically helps to neutralize the effect of sun. I remember looking into it a while ago. I think it's not bad to try. There's not data on it in APP. So it's a lot of things like that. It's not going to hurt. So if there's like, you want to try and see what works, definitely can encourage it. I think it's probably sort of similar to beta carotene, that what a lot of people have tried, where it's basically a strong antioxidant that would help neutralize some of the negative effects of light, is my impression of it. Yeah.
Are there devices available to check the strength of blue light, similar to how we have devices that can check for UV strength?
Yes. Well, there isn't currently now, but I'm doing a lot of research on it. We're working on a device that measures UV blue, red light every 2 minutes. And so I'm hoping to have some device where some people can wear a watch and have an app, and it gives you information about the accumulated blue light and gives you warnings about symptom risk. This device we've been using as an exploratory endpoint for our cimetidine clinical trial, and also the bitopertin for EPP clinical trial. And so we're in the process of analyzing the data and trying to come up with models of how to predict symptoms based on what light doses and symptoms and protoporphyrin levels and other characteristics of patients. So it's very, very complicated math. So we're working on it. So we hopefully at some point we'll have a device like that, and we're in the process of like doing research on it. So if any of you have interest in helping with research on that topic, definitely reach out to me, because we'll be doing some more studies on it in the next months, years.
I actually have a question. Now that I am on bitopertin, I am struggling with sunburns because I never knew them before, and I'm struggling finding sunscreens that have the appropriate level of protection. I did get sun blisters on my face because I was not careful. And I would like to avoid that again.
Yeah,
Of course,
so
the hat, besides a hat.
because with EPP, like sunscreens don't really work very much. So a lot of EPP patients, we haven't had a lot of history of using sunscreens because it didn't really, do that much for EPP symptoms. So, but now with bitopertin, people can be in the sun a lot more, but having regular sunburns. Some of the sunscreens that I shared, let's see. This list of sunscreens. So, these help with, EPP, but, maybe help with EPP, but certainly help with preventing sunburns. And so I would recommend, because you also have EPP, probably pick one that kind of has kind of like dual action if you're going to pick one. And these are sunscreens that can be used on the face and the body. And should rub in pretty well. So, these are different ones to try. So both sunscreens and, a lot of sunscreens you have to reapply to because, a lot of times they, after a few hours, they don't have the same effect. And
I
then,
think that's where I failed.
yeah. So I have to keep reapplying them. And then also just light protective clothing helps with sunburns too. But yeah, I don't know if anyone else has any tips or
Anybody
skills.
else? Anybody else? I think that might be it for the questions.
Oh, I have a comment, if I may.
Mhm. Yeah.
One, I find that the type of clothing that's really helpful would be denim if somebody's trying to take care of their little one. Denim long sleeve shirt, that type of thing. It's such a tight weave typically. And well, I think that was my thought because I'm not remembering the other thing, sadly. But
Yeah,
anyway,
that's a good point. Because, like, if you take denim and shine a flashlight on it, there's no light coming out the other end.
right.
With
Oh,
a lot of
I
other.
remembered what I was gonna say. I'm so sorry.
No, no.
If somebody's a caregiver to their child or another adult, I think too to remember indirect light. Sometimes I'll be in the car and I'm thinking, what is it? I feel the light, and so it's just a reflection off of a water thing, like one of the simple water things that has a reflective thing on top, or the dash is bright, or as I know a lot of people say, the bumper in front of them. So if you're a parent trying to keep a child safe, do consider reflective light. That's all.
I feel like I always watch for the shine when I'm driving. If you can see shine, you're getting reflective light. If any parents can see a shine off of another car, a window, everything shines. Everything reflects light back up at you or at you. So if you can see shine, that is a problem.
Yeah, one time I got some flip-flops that were like metallic and like I don't wear flip-flops that much, but it was like the worst choice ever because I got reaction so much quicker because I think the light from the metallic was like shining onto my foot. I had the worst reaction ever. I basically had burst blood vessels on my feet such that my feet were not a normal color for a full year after that. It was so bad. So no metallic. But yeah, a lot of people, I mean, certainly if other people have suggestions or, like I have my own experience in showing some of the data, but I think everyone has their like, expert, tips and tricks and would love to hear from other people too.
Is there any data or studies showing the impact to overall health with persons who have EPP later in life?
So for EPP, the main long-term like health thing that can affect people besides the light is the liver. It's not related to light exposure, but the protoporphyrin itself can get clogged in the liver and cause liver damage. Other than that, there is not, there's some people that have needed a liver transplant or other things if it gets severe, but other than that, there's not a big, otherwise health effect. It certainly affects quality of life and other, a lot of different like things, but shouldn't affect, as far as we know, doesn't have an effect on other health parameters.
Does anyone have recommendations for UV filters for car windows? Are they actually helpful? I've tried some and they don't seem to help me much.
I just responded to that. Ceramic tint is, you can get it basically clear or very low tint, and you can have it on your windshield, which is my problem with driving. It's the reflective light is hitting my hands. So ceramic tint, I stand by it 100%. Limo tint is great, but the problem with limo tint is so dark you can't see at night.
And you
So,
get pulled over every
Yeah.
day.
so ceramic tint is the best.
Yeah. I did have some information about like a 3M filter that I'm trying to find it on my computer.
I think the ceramic is 3M, to be
Okay.
honest.
Okay. Um,
It's cleaner too,
Yeah.
like on the window itself.
mhm. I think the filter, well, I guess this is Amber 81 is I think this is also like a surgical light filter from Matico, but I think it's for like, I think they have,
Homes.
yeah, of homes and other things, but basically trying to block light from like UV up to 500 nanometers. A lot of people with who are using the tints are just caring about the UV, not the visible light. So it's important, if a lot of those filters have information about what nanometers of light it's blocking. So try to block from like the, UV up to like 500 if you can. And I think the UPA has also other information about specific brands of light filters for cars and such. So if you're interested in that, could reach out to them. So I don't have all that information at hand. But yeah, it seems like, Victor and others have tried different things and have some of that information. So yeah, thanks.
Is there any more questions?
Or comments and tips.
Well,
Well,
I have one. I'm not a person who uses marijuana, not since I was a high school kid. But is there any kind of relief? I know somebody at Mount Sinai or somewhere in California might have been studying that, and I was just curious. And do they do it to prevent pain at all, or do they take it to prevent, or to make the once the reaction's full blown, then it's helpful, or it
Yeah,
sounds like there's not much that helps a reaction, but I just didn't know whatever became of that.
I think I've heard people trying it during reactions to help with the pain or symptoms. I'm a pulmonologist, so I'm not a big fan of marijuana.
do you like me to answer the question? I'll answer
Or
the
maybe
question.
it's edible.
Ginger can
Edible.
share.
I'll take this one. So I have tried marijuana and it does not help for the pain, but what it does help with is the anxiety and the stress and the not sleeping. So if you get the right marijuana, because you don't want to get like you have to get like a indica, a deep indica, and it will help you sleep, but it's not going to help with the pain. It doesn't do anything for the pain. It helps with just the anxiety and sleeping.
I agree. It takes the edge off. It just takes the edge off enough to maybe make your mind relax a little bit.
Do you know how you get wild? I think only like you get wilds when you're in that state. Your brain isn't working. You're not functioning. You're like a zombie because you've been up for however long. And it is just to calm me down, helps me eat, and it helps me sleep. But for the pain, I have not had anything successful except for ice.
Mhm.
The other question I'd have is,
Oh, sorry, I just want to comment. Like, I think with all those things, it's just, important to be careful and to be wise. I think a lot of people can use too much marijuana, or, you know, there's a lot of times like, you know, edibles, it can have too much concentration and have really big problems, and also like smoking things that can damage your lungs. So just be careful. You know, I think you know, there's certain things that may or may not, like, yeah, for instance, like, anyways, yeah, that's all I'll say.
You want to weigh out your options, is what she's saying.
Yeah, anyways, do not hear me recommending marijuana for
Desperate people, desperate times.
Not official.
Dr. Amy, I have a question if we still have time.
Yeah.
Just piggybacking off of like trying to get to sleep and stuff, like some of my worst reactions, like a lot of people here, I'm up till like 4 or 5, 6 in the morning, and I usually just end up going to bed because my body's just exhausted. But regardless of like what time I go to bed, it seems like whenever I go to bed, when I wake up, you know, the burn comes out, I see it on my skin, or just like I'm at like 80% less pain. Is there any reason why going to bed and waking up the next day, like all my effects or side effects seem to be damaged? Just my body, like, hey, we've shut down, and some
Recovery.
I don't know. I think maybe just the time, you know, because I think just, I mean, I don't, there's no date on this. This is just my thought, you know. I think just kind of like waiting it out helps with the pain. And so overnight, I think there's just maybe extra time. So in the morning, it's a bit better. But yeah, I think yeah, sleeping is a hard thing. You know, I think sometimes, you know, you could get prescription sleep meds like Ambien or something could be helpful. Like, you know, I've talked to some EPP patients who like their strategy is to like, you know, drink a lot of alcohol, get drunk, and I'm like, please don't do that. That hurts your liver and EPP. You know, there's like other things that you could or could not, you know, make you sleep, but it's just like, be careful. So yeah, anyways,
who
it's so
are the patients? Can you put me in contact with them?
I will not name any names. Like, actually, they were recommending to me that I try this, and I was like, I'm just not gonna be nice. But yeah, I think, you know, the best thing for EPP reactions is to avoid it. Obviously, you know, there's really nothing we can do very well to treat it once it starts, and just like, you know, waiting it out till it goes away. So yeah, and I'm trying to work to do some more research to try to find things that might help the pain in EPP, but we're a long ways from having that, unfortunately.
I was gonna say we'd open it up for a broader discussion, but I think we already did.
Yeah. Yeah, we've just been discussing. But yeah, I mean, you know, in terms of this, I think, you know, I'm interested in trying to, you know, I share some EPP patients, you know, experiences and what they do. You know, I'm probably going to be doing a survey to get some more information about what patients have tried and think are helpful. And so if any of you are interested in that, you know, contributing to that, let me know. I think, you know, in terms of this, like I have some, you know, experience as a patient. There's not really much data in terms of EPP and light protection. So, you know, you guys are as much an expert as I am about some of these things.
Does anybody in here have like the best tip that we haven't heard today? Anyone? I think Victor actually gave me a few good tips, where hot shower, which I would have never done in my entire life, after a thing that does sort of reset you if you can do it in time. And cutting your nails short. If you have a child with EPP, cutting their nails short stops the bleeding and the itching if you can keep that under control. My grandmother used to tape my fingertips at night with like tape so I couldn't. Anybody else have anything they'd like to share?
This one isn't from personal experience, but Jerome from the Netherlands at a conference a couple years ago mentioned that he gets a light balance app that you use for photography, and it will tell you kind of what wavelengths are present. So he said he uses it just to check how much blue light is in things, and he said it was really helpful.
That's interesting.
That's great.
When we're outside, it's helpful to turn the conversation. It's just natural now to turn the conversation where my back is to the sun. I could put the hoodie on. So even when I was on Sinus, I still did it all the time. And then when I realized I did it and like, wait, I'm on Sinus, I turn it back the other way again.
It's a struggle. I mean, even with bitopertin, I find you have a whole lifetime built in you. And it's going to take years for us to undo that kind of trauma that you have from the fear of being burned or just the fear of a reaction.
For the volleyball player, I don't know if she's tried and if she's willing to be kind of out there with her costume, but certainly wearing a ball hat and maybe just making sure that zinc gets patted onto her lips heavily, patting it on.
Yeah, that's true. Because most sunscreens, you don't use on your lips, and sometimes you can have EPP symptoms on the lips too. So there are like kind of zinc oxide chapsticks and things like that too.
And I'm not sure gloves, you playing volleyball, you could really wear gloves. You really need that hand. So that's tough. Anyone else have any questions for Dr. Dickey today?
Tylenol's bad for our liver, so I wouldn't be taking Tylenol, isn't that right?
Tylenol, not taking too much Tylenol, like low doses of Tylenol should be okay. Tylenol doesn't have a negative effect on the liver unless you get above a certain threshold. So even like liver failure patients, or like liver transplantation, a lot of liver doctors are okay with like a small amount of Tylenol, just not a lot of Tylenol.
Thank you.
You guys maybe we can wrap it up because we want to be respectful of Dr. Dickey's time. I know that she's at a baby shower today and she has been hiding and, doing this for us, and we really appreciate your time.
Yeah, it's good to be with all of you. I hope it was helpful. I don't have very conclusive things, but just sharing some of the science and tips, and feel free to reach out to me with any other questions, comments. So it's great to hear you guys' tips, as you guys are experts on this as well. So.
Anna, do you want to show us some of the upcoming events? We have a live Q&A with Dr. Wang coming up on May 17th. We have Global Porphyria Day on May 18th, and we have the Patient and Family Conference on October 1st. And there's also a little camp going on in the beginning of May. Visit our newly updated website, porphyria.org, to stay tuned and stay connected year-round. Additionally, I encourage you to subscribe to our e-news by clicking the Join Us button on porphyria.org. Find us on social media. If you'd like to share your story, contact Myra at porphyria.org. Thank you again for taking the time to learn with us today. You'll be asked to fill out a quick evaluation when you leave the webinar. Please take a few minutes to share your feedback. It really helps develop and deliver resources that meet your needs. I hope you guys have an awesome weekend. I am so appreciative that you've joined us today. And thank you, Dr. Dickey, and thank you to the UPA. And I hope you guys enjoy your Saturday.
Take care.